Welcome to one of the toughest NCLEX critical care rapid-fire challenges you'll face. These 50 high-yield questions are designed around the concepts that nursing students miss most often on the NCLEX: hemodynamic instability, shock, ventilator management, ECG interpretation, emergency medications, ABGs, electrolyte imbalances, and priority nursing interventions. You'll have only a few seconds to think before revealing each answer, just like the pressure of the real exam. Don't just memorize the correct option. Focus on the clinical reasoning behind every decision. Keep track of your score and see how many you can answer correctly before the timer runs out. Ready? Let's put your critical care knowledge to the test. Question 1. A 67-year-old client is admitted to the ICU with septic shock secondary to pneumonia. The client is intubated and receiving norepinephrine at 18 micrograms per minute. Current assessment findings include MAP 58 millimeters of mercury, CVP 3 millimeters of mercury, urine output 15 milliliters per hour, lactate 5.2 millimoles per liter, HR 132 per minute, and cool mottled extremities. Which intervention should the ICU nurse anticipate implementing first to improve tissue perfusion? A. Increase the norepinephrine infusion rate immediately. B. Administer a rapid isotonic crystalloid bolus as prescribed. C. Prepare the client for emergent hemodialysis. D. Reduce ventilator PEEP to improve preload. Answer. B. Administer a rapid isotonic crystalloid bolus as prescribed. Rationale. The client demonstrates persistent hypoperfusion with evidence of inadequate preload, CVP 3 millimeters of mercury, despite vasopressor therapy. Septic shock management prioritizes aggressive fluid resuscitation before escalating vasopressors when preload remains low. Question 2. A client with acute respiratory distress syndrome, ARDS, is receiving mechanical ventilation with high PEEP. The ICU nurse notes sudden hypotension, distended neck veins, absent breath sounds on the right side, and tracheal deviation toward the left. Which action is the nurse's priority? A. Increase oxygen delivery to 100%. B. Obtain a stat portable chest X-ray. C. Prepare for immediate needle decompression. D. Lower the tidal volume setting. Answer. C. Prepare for immediate needle decompression. Rationale. The client is exhibiting signs of tension pneumothorax, a life-threatening emergency commonly associated with mechanical ventilation and high PEEP. Immediate decompression is required before diagnostic confirmation. Question 3. A client with diabetic ketoacidosis, DKA, is receiving an insulin infusion. Laboratory values reveal potassium 3.0 milliequivalent/L, glucose 420 milligrams per deciliter, bicarbonate 12 milliequivalent/L, and pH 7.24. Which prescription should the ICU nurse question? A. Initiate potassium replacement therapy. B. Continue hourly glucose monitoring. C. Increase insulin infusion per protocol. D. Administre isotonique 4 fluides. Answer. C. Increase insulin infusion per protocol. Rationale. Insulin administration drives potassium intracellularly and can precipitate fatal dysrhythmias when potassium is already critically low. Potassium replacement must occur before increasing insulin therapy. Question 4. A client is 6 hours post-operative following coronary artery bypass graft surgery. Chest tube drainage has increased from 80 milliliters per hour to 260 milliliters per hour over the last hour. Blood pressure is 88/50th millimeter of mercury, HR 126 per minute, and CVP is decreasing. Which action should the ICU nurse take first? A. Notify the cardiac surgeon immediately. B. Administer morphine for pain. C. Clamp the chest tubes temporarily. D. Place the client in Trendelenburg position. Answer. A. Notify the cardiac surgeon immediately. Rationale. Excessive mediastinal drainage after cardiac surgery suggests hemorrhage and possible surgical bleeding requiring immediate provider notification and rapid intervention. Question 5. A client with severe traumatic brain injury has an ICP reading of 28 millimeters of mercury. The nurse observes the following: BP 188/62 mmHg, HR 46 per minute, irregular respirations, and unequal pupils. Which interpretation by the nurse is most accurate? A. The client is developing neurogenic shock. B. The findings suggest worsening intracranial hypertension with herniation risk. C. The client is experiencing opioid toxicity. D. The assessment findings are expected during therapeutic hypothermia. Answer: B. The findings suggest worsening intracranial hypertension with herniation risk. Rationale: Cushing's triad, widened pulse pressure, bradycardia, irregular respirations, with unequal pupils indicates severe intracranial hypertension and impending brain herniation. Question 6. A client receiving a heparin infusion for pulmonary embolism suddenly develops hematuria, bleeding from the foresite, and APTT of 142 seconds. Which medication should the ICU nurse anticipate administering? A. Vitamin K. B. Protamine sulfate. C. Tranexamic acid. D. Desmopressin. Answer: B. Protamine sulfate. Rationale: Protamine sulfate is the antidote for heparin toxicity and is indicated when severe bleeding occurs with supratherapeutic anticoagulation. Question 7. A mechanically ventilated client with COPD becomes increasingly agitated. Ventilator alarms indicate high-pressure alarms. Assessment reveals diminished breath, sounds bilaterally, prolonged expiration, and oxygen saturation dropping from 95% to 82%. Which intervention should the nurse perform first? A. Increase the respiratory rate setting. B. Disconnect the ventilator and manually ventilate with 100% oxygen. C. Administer 4-sodium bicarbonate. D. Place the client in a supine position. Answer: B. Disconnect the ventilator and manually ventilate with 100% oxygen. Rationale: The client may be experiencing severe air trapping or ventilator malfunction. Immediate manual ventilation allows rapid assessment of compliance and oxygenation while troubleshooting the cause. Question 8. A client with acute pancreatitis develops worsening respiratory distress. ABG results are pH 7.31, PaCO2 50 millimeters of mercury, PaO2 58 millimeters of mercury, HCO3 25 milliequivalent/L. Which interpretation is most accurate? A. Metabolic alkalosis with compensation. B. Respiratory acidosis with hypoxemia. C. Mixed respiratory alkalosis and metabolic acidosis. D. Fully compensated respiratory acidosis. Answer: B. Respiratory acidosis with hypoxemia. Rationale: The pH is acidotic, PaCO2 is elevated, and bicarbonate is normal, indicating acute respiratory acidosis. Severe hypoxemia is also present. Question 9. An ICU client with massive GI bleeding is receiving blood transfusions rapidly through a central line. Which finding requires immediate intervention by the nurse? A. Ionized calcium level of 0.88 millimoles per liter. B. Temperature of 36.2 degrees Celsius, 97.1 degrees Fahrenheit. C. Potassium level of 5.1 milliequivalent/L. D. Hemoglobin of 8.4 g/dl. Answer: A. Ionized calcium level of 0.88 millimoles per liter. Rationale: Massive transfusion can cause citrate toxicity leading to hypocalcemia, which may precipitate hypotension and lethal dysrhythmias. Question 10. A client with cardiogenic shock is receiving dobutamine. Which assessment finding best indicates the medication is achieving the desired therapeutic effect? A. Increased systemic vascular resistance. B. Decreased urine output. C. Improved cardiac output and tissue perfusion. D. Reduction in serum sodium levels. Answer: C. Improved cardiac output and tissue perfusion. Rationale: Dobutamine is an inotropic agent that improves myocardial contractility and cardiac output, resulting in improved perfusion and organ function. Question 11. A 58-year-old client with severe sepsis is receiving vasopressor therapy through a central venous catheter. During assessment, the ICU nurse notices blanching, swelling, and coolness around the insertion site. The norepinephrine infusion is running at 24 micrograms per minute. Which action should the nurse take first? A. Slow the infusion rate and reassess in 15 minutes. B. Stop the infusion and disconnect the tubing immediately. C. Aspirate any residual medication from the catheter while stopping the infusion. D. Apply a warm compress and continue monitoring. Answer. C. Aspirate any residual medication from the catheter while stopping the infusion. Rationale. The client is showing signs of vasopressor extravasation, which can cause severe tissue necrosis. The nurse should stop the infusion, aspirate residual medication, and initiate treatment per protocol. Question 12. A client with acute ischemic stroke suddenly becomes less responsive 24 hours after admission. Assessment reveals BP 210/100 mmHg, projectile vomiting, unequal pupils, and decorticate posturing. Which complication should the ICU nurse suspect? A. Hypoglycemia. B. Hemorrhagic transformation with increased ICP. C. Neurogenic diabetes insipidus. D. Acutopua withdrawal. Answer. B. Hemorrhagic transformation with increased ICP. Rationale. Neurological deterioration, severe hypertension, vomiting, posturing, and unequal pupils strongly suggest intracranial hemorrhage with rising intracranial pressure. Question 13. A client with ARDS is being mechanically ventilated using low tidal volume ventilation, which finding most strongly indicates ventilator-induced barotrauma. A. PaCO2 of 52 millimeters of mercury. B. Plateau pressure of 19 centimeters H2O. C. Sudden onset subcutaneous emphysema. D. Bilateral crackles in the lung bases. Answer. C. Sudden onset subcutaneous emphysema. Rationale. Subcutaneous emphysema suggests alveolar rupture with air leakage into surrounding tissues, a classic manifestation of barotrauma. Question 14. The ICU nurse is caring for a client with acute liver failure. Which assessment finding requires the most immediate intervention? A. Serum ammonia level of 132 micrograms per deciliter. B. Hysterexis during neurological assessment. C. New onset confusion and decreased level of consciousness. D. Total bilirubin level of 8.4 milligrams per deciliter. Answer. C. New onset confusion and decreased level of consciousness. Rationale. Acute neurological decline may indicate worsening hepatic encephalopathy or cerebral edema, both of which are life-threatening complications of liver failure. Question 15. A client with septic shock is receiving broad-spectrum antibiotics and aggressive fluid resuscitation. Which hemodynamic finding best suggests fluid overload rather than continued hypovolemia? A. CVP 2 millimeters of mercury with flat neck veins. B. Pulmonary crackles with elevated CVP. C. MAP 58 millimeters of mercury and cool extremities. D. Urine output 10 milliliters per hour. Answer. B. Pulmonary crackles with elevated CVP. Rationale. Elevated central venous pressure combined with pulmonary crackles suggests excessive intravascular volume leading to pulmonary congestion. Question 16. A client with status epilepticus continues seizing despite lorazepam administration. Which medication should the ICU nurse anticipate administering next? A. Acetaminophen. B. Phenytoin or fosphenytoin. C. Mannitol. D. Naloxone. Answer. B. Phenytoin or fosphenytoin. Rationale. Benzodiazepines are first-line therapy for status epilepticus, but longer-acting anticonvulsants, such as phenytoin, are required for seizure control after initial stabilization. Question 17. A postoperative ICU client develops sudden dyspnea, chest pain, tachycardia, and decreasing oxygen saturation despite oxygen therapy. Which assessment finding would most strongly support pulmonary embolism? A. Bradycardia with hypertension. B. Frothy pink sputum. C. Sudden increase in dead space ventilation and hypotension. D. Bilateral wheezing relieved by bronchodilators. Answer: C. Sudden increase in dead space ventilation and hypotension. Rationale: pulmonary embolism impairs pulmonary perfusion, increasing dead space ventilation and potentially causing obstructive shock with hypotension. Question 18. A client with severe burns is receiving large volume fluid resuscitation. Which assessment finding indicates the resuscitation is effective? A. Urine output of 45 milliliters per hour. B. Sérum potassium 6 points en MCQs. C. Generalized edema with crackles. D. Hematocrit continuing to rise. Answer: A. Urine output of 45 milliliters per hour. Rationale: adequate urine output is one of the best indicators of effective fluid resuscitation and adequate organ perfusion in burn clients. Question 19. A client receiving mechanical ventilation suddenly develops autopeep. Which assessment finding is most consistent with this complication? A. Increased exhalation time with dynamic hyperinflation. B. Bradycardia with increased bowel sounds. C. Low peak inspiratory pressures. D. Increased sputum production with fever. Answer: A. Increased exhalation time with dynamic hyperinflation. Rationale: autopeep occurs when incomplete exhalation causes trapped air and dynamic hyperinflation, commonly seen in obstructive lung disease. Question 20. A client with severe metabolic acidosis secondary to shock has ABG results of pH 7.08, PaCO2 24 millimeters of mercury, HCO3 8 milliequivalent/L. Which interpretation by the ICU nurse is most accurate? A. Fully compensated respiratory alkalosis. B. Uncompensated metabolic acidosis. C. Metabolic acidosis with partial respiratory compensation. D. Mixed metabolic alkalosis and respiratory acidosis. Answer: C. Metabolic acidosis with partial respiratory compensation. Rationale: the severely low bicarbonate confirms metabolic acidosis, while the low PaCO2 indicates respiratory compensation. The pH remains abnormal, so compensation is only partial. Question 21. A client with acute decompensated heart failure is receiving 4-nitroglycerin and furosemide. During assessment, the ICU nurse notes increasing confusion, cool, clammy skin, BP 78 40 millimeter of mercury, HR 128 per minute, and urine output 12 milliliters per hour. Pulmonary artery catheter readings reveal elevated pulmonary capillary wedge pressure and low cardiac index. Which complication should the nurse suspect? A. Neurogenic shock. B. Cardiogenic shock. C. Septic shock. D. Hypovolemic shock. Answer: B. Cardiogenic shock. Rationale: elevated filling pressures with poor cardiac output, hypotension, oliguria, and hypoperfusion are classic findings of cardiogenic shock resulting from pump failure. Question 22. A client with traumatic brain injury is receiving mannitol therapy. Which assessment finding requires immediate intervention by the ICU nurse? A. Serum osmolality 318 mmOsm/kg. B. Urine output 65 milliliters per hour. C. Crackles and worsening pulmonary edema. D. ICP decreasing from 24 millimeters of mercury to 16 millimeters of mercury. Answer: C. Crackles and worsening pulmonary edema. Rationale: mannitol shifts fluid into the intravascular space and may precipitate pulmonary edema, especially in clients with compromised cardiac or renal function. Question 23. A client receiving continuous renal replacement therapy, CRRT, suddenly develops muscle twitching, hypotension, and prolonged QT interval on telemetry. Which electrolyte imbalance should the ICU nurse suspect? A. hypermagnesemia. B. Hypocalcemia. C. Hypernatremia. D. Hyperphosphatemia. Answer. B. Hypocalcemia. Rationale. Hypocalcemia can occur during CRRT, particularly with citrate anticoagulation, and may manifest as muscle twitching, hypotension, and prolonged QT interval. Question 24. A mechanically ventilated client with severe ARDS is placed in the prone position. Which outcome best indicates the intervention is effective? A. Decreased urine output. B. Improved PaO2 and oxygen saturation. C. Increased PaCO2 retention. D. Development of facial edema. Answer. B. Improved PaO2 and oxygen saturation. Rationale. Prone positioning improves ventilation perfusion matching and alveolar recruitment, leading to improved oxygenation in ARDS clients. Question 25. A client with severe pancreatitis suddenly develops restlessness, tachypnea, and oxygen saturation of 84% despite oxygen via non-rebreather mask. Which action should the ICU nurse anticipate first? A. Initiate enteral feeding. B. Prepare for endotracheal intubation. C. Administer sodium bicarbonate. D. Restrict 4 fluids. Answer. B. Prepare for endotracheal intubation. Rationale. Severe hypoxemia despite high-flow oxygen indicates impending respiratory failure requiring airway protection and mechanical ventilation. Question 26. A client with a massive pulmonary embolism is receiving alteplase therapy. Which assessment finding requires the nurse's most immediate action? A. Oozing at the fore-insertion site. B. Hematuria noted in the urinary catheter tubing. C. Sudden decrease in level of consciousness. D. Mild gum bleeding during oral care. Answer. C. Sudden decrease in level of consciousness. Rationale. A sudden neurological change during thrombolytic therapy may indicate intracranial hemorrhage, a life-threatening complication requiring immediate intervention. Question 27. An ICU client with septic shock is receiving vasopressin and norepinephrine infusions. Which finding most strongly suggests worsening tissue hypoperfusion? A. Lactate level increasing from 3.8 to 6.4 millimoles per liter. B. MAP increasing to 72 millimeters of mercury. C. Urine output 45 milliliters per hour. D. Warm flushed skin. Answer. A. Lactate level increasing from 3.8 to 6.4 millimoles per liter. Rationale. Rising lactate levels indicate worsening anaerobic metabolism and inadequate tissue perfusion despite hemodynamic support. Question 28. A client with COPD on mechanical ventilation develops hypotension immediately after an increase in PEEP. Which explanation is most accurate? A. Increased venous return to the heart. B. Reduced intrathoracic pressure. C. Decreased preload secondary to elevated intrathoracic pressure. D. Acute systemic vasodilation from oxygen therapy. Answer. C. Decreased preload secondary to elevated intrathoracic pressure. Rationale. High PEEP increases intrathoracic pressure, reducing venous return and cardiac preload, which can result in hypotension. Question 29. A client with upper GI bleeding has a Sengstaken-Blakemore tube inserted. Which nursing action is the priority? A. Keep scissors readily available at the bedside. B. Irrigate the gastric port every hour. C. Deflate the esophageal balloon every 30 minutes. D. Position the client flat to prevent migration. Answer. A. Keep scissors readily available at the bedside. Rationale. Airway obstruction is a life-threatening complication of balloon tamponade tubes. Scissors must remain at the bedside to cut the tube in an emergency. Question 30. A client with severe sepsis has the following assessment findings. Temperature 39.6 degrees Celsius, 103.3 degrees Fahrenheit, HR 138 per minute, RR 34 per minute, WBC 22, 000/mm superscript 3, BP 84/48 mm of mercury, and mottled extremities. Which intervention should the ICU nurse implement first? A. Obtain blood cultures after antibiotics are administered. B. Administer broad-spectrum antibiotics immediately. C. Apply a cooling blanket for fever reduction. D. Administer vasopressors before fluid resuscitation. Answer: B. Administer broad-spectrum antibiotics immediately. Rationale: early administration of broad-spectrum antibiotics is a critical priority in septic shock management and is associated with improved survival outcomes. Question 31. A client with acute respiratory failure is receiving mechanical ventilation. The ICU nurse notes a sudden high-pressure alarm, severe agitation, oxygen saturation dropping to 78%, and absent breath sounds on the left side. Which intervention should the nurse perform first? A. Increase the FiO2 to 100% and continue monitoring. B. Assess for possible tension pneumothorax and notify the provider immediately. C. Administer forced sedation to reduce agitation. D. Suction the endotracheal tube for 30 seconds. Answer: B. Assess for possible tension pneumothorax and notify the provider immediately. Rationale: sudden respiratory deterioration with unilateral absent breath sounds and high-pressure alarms strongly suggests tension pneumothorax, a medical emergency requiring rapid intervention. Question 32. A client with septic shock is receiving aggressive fluid resuscitation. Which finding indicates the client may be developing acute respiratory distress syndrome, ERDS? A. Increased urine output and bounding pulses. B. Bilateral pulmonary infiltrates with refractory hypoxemia. C. Elevated blood glucose and fever. D. Bradycardia with widened pulse pressure. Answer: B. Bilateral pulmonary infiltrates with refractory hypoxemia. Rationale: ERDS is characterized by non-cardiogenic pulmonary edema, bilateral infiltrates, and severe hypoxemia that does not respond adequately to oxygen therapy. Question 33. A client with severe traumatic injuries receives multiple blood transfusions. Which assessment finding most strongly suggests transfusion-associated circulatory overload, TACO? A. Fever, hypotension, and diffuse bleeding. B. Acute hypertension, crackles, and jugular venous distension. C. Urticaria and wheezing during transfusion. D. Flank pain with hemoglobinuria. Answer: B. Acute hypertension, crackles, and jugular venous distension. Rationale: TACO results from volume overload and commonly presents with pulmonary edema, hypertension, elevated venous pressures, and respiratory distress. Question 34. An ICU client with diabetic ketoacidosis has the following laboratory values after treatment: glucose 190 milligrams per deciliter, potassium 3.2 milliequivalent/L, bicarbonate 17 milliequivalent/L, and anion gap still elevated. Which intervention should the nurse anticipate? A. Discontinue insulin infusion immediately. B. Transition to oral hypoglycemics. C. Continue insulin infusion with potassium replacement. D. Restrict 4 fluids to avoid overload. Answer: C. Continue insulin infusion with potassium replacement. Rationale: insulin therapy should continue until the anion gap closes, indicating resolution of ketoacidosis. Potassium replacement is necessary because insulin lowers serum potassium further. Question 35. A client with intracranial hemorrhage develops sudden bradycardia, hypertension, and irregular respirations. Which action by the ICU nurse is the priority? A. Reduce environmental stimulation. B. Prepare for emergent airway and ICP management. C. Administer oral antihypertensive medication. D. Encourage coughing and deep breathing exercises. Answer: B. Prepare for emergent airway and ICP management. Rationale: these findings indicate Cushing's triad, suggesting critically increased intracranial pressure and impending herniation requiring immediate intervention. Question 36. A client with severe heart failure is receiving a nitroprusside infusion. Which finding requires immediate nursing intervention? A. Sudden metabolic acidosis with elevated lactate levels. B. Mild headache after infusion initiation. C. BP decreasing from 170/92 mmHg to 138/78 mmHg. D. Heart rate decreasing from 118 per minute to 96 per minute. Answer. A. Sudden metabolic acidosis with elevated lactate levels. Rationale. Nitroprusside toxicity can lead to cyanide accumulation, causing metabolic acidosis and elevated lactate levels, which require immediate intervention. Question 37. A client with acute kidney injury has peak T waves, widening QRS complexes, and serum potassium of 7.2 milliequivalent/L. Which medication should the ICU nurse anticipate administering first? A. Sodium polystyrene sulfonate. B. Calcium gluconate. C. Regular insulin only. D. Furosemide. Answer. B. Calcium gluconate. Rationale. Calcium gluconate stabilizes the cardiac membrane and is the immediate priority in severe hyperkalemia with ECG changes. Question 38. A client with septic shock develops disseminated intravascular coagulation, DSC. Which assessment finding is most consistent with this complication? A. Excessive clotting with no bleeding. B. Simultaneous bleeding and microvascular thrombosis. C. Severe hypertension and bradycardia. D. Elevated platelet count and hemoconcentration. Answer. B. Simultaneous bleeding and microvascular thrombosis. Rationale. DSE involves widespread activation of coagulation, leading to both clot formation and consumption of clotting factors, causing bleeding. Question 39. A mechanically ventilated client receiving sedation becomes suddenly difficult to arouse. ABGS reveal pH 7.19, PACO 72 mmHg, PAO 84 mmHg, HCO 27 MQL. Which interpretation is most accurate? A. Acute respiratory acidosis. B. Fully compensated metabolic acidosis. C. Respiratory alkalosis with compensation. D. Mixed metabolic alkalosis and respiratory acidosis. Answer. A. Acute respiratory acidosis. Rationale. The low pH and significantly elevated PaCO2 with near normal bicarbonate indicate acute respiratory acidosis from hypoventilation. Question 40. A client with severe burns develops circumferential chest burns and increasing respiratory distress. Which assessment finding requires immediate intervention? A. Mild tachycardia and pain at the burn site. B. Increasing airway pressures and decreased chest expansion. C. Low-grade fever and anxiety. D. Serous drainage from the burn wounds. Answer. B. Increasing airway pressures and decreased chest expansion. Rationale. Circumferential chest burns can restrict thoracic expansion and impair ventilation, potentially requiring emergent escharotomy. Question 41. A client with severe sepsis is receiving mechanical ventilation and develops sudden hypotension, tachycardia, distended neck veins, and muffled heart sounds. Which complication should the ICU nurse suspect first? A. Pulmonary edema. B. Cardiac tamponade. C. Neurogenic shock. D. Acute myocardial infarction. Answer. B. Cardiac tamponade. Rationale. Hypotension, jugular venous distension, and muffled heart sounds represent Beck's triad, a hallmark of cardiac tamponade causing obstructive shock. Question 42. A client with acute respiratory distress syndrome, ARDS, is receiving neuromuscular blockade. Which nursing intervention is the highest priority during paralysis? A. Discontinue all sedation to improve neurological assessment. B. Ensure adequate sedation and analgesia before and during paralysis. C. Encourage active range of motion exercises hourly. D. Reduce ventilator alarms to prevent stimulation. Answer. B. Ensure adequate sedation and analgesia before and during paralysis. Rationale: neuromuscular blockers do not provide sedation or pain relief. A conscious but paralyzed client can experience severe psychological trauma if sedation is inadequate. Question 43. A client with massive trauma develops oliguria, abdominal distension, increasing peak airway pressures, and hypotension. Bladder pressure measurement is significantly elevated. Which condition should the ICU nurse suspect? A. Neurogenic bladder. B. Abdominal compartment syndrome. C. Acute pancreatitis. D. Hepatorenal syndrome. Answer: B. Abdominal compartment syndrome. Rationale: elevated intra-abdominal pressure causing organ dysfunction, respiratory compromise, and hypotension is characteristic of abdominal compartment syndrome. Question 44. A client with acute myocardial infarction suddenly develops confusion, cool extremities, pulmonary crackles, and systolic BP 76 millimeters of mercury. Which hemodynamic parameter would the ICU nurse expect? A. High cardiac output with low SVR. B. Low pulmonary artery wedge pressure. C. Elevated pulmonary artery wedge pressure with low cardiac output. D. Increased preload with bounding peripheral pulses. Answer: C. Elevated pulmonary artery wedge pressure with low cardiac output. Rationale: cardiogenic shock after myocardial infarction leads to pump failure, elevated filling pressures, pulmonary congestion, and reduced cardiac output. Question 45. A client receiving enteral nutrition through a nasogastric tube suddenly begins coughing violently and develops oxygen saturation of 85%. Which action should the ICU nurse take first? A. Increase the feeding rate to improve caloric intake. B. Stop the feeding and assess for aspiration. C. Place the client flat in bed. D. Irrigate the tube with sterile saline. Answer: B. Stop the feeding and assess for aspiration. Rationale: sudden coughing and hypoxemia during enteral feeding strongly suggest aspiration, requiring immediate cessation of feeding and respiratory assessment. Question 46. A client with severe traumatic brain injury has a cerebral perfusion pressure, CPP, of 52 millimeters of mercury. ICP is 24 millimeters of mercury and MAP is trending downward. Which action should the ICU nurse anticipate? A. Lower blood pressure aggressively. B. Increase measures to improve cerebral perfusion. C. Restrict 4 fluids completely. D. Hyperventilate continuously to PaCO2 below 25 millimeters of mercury. Answer: B. Increase measures to improve cerebral perfusion. Rationale: CPP below 60 millimeters of mercury can compromise cerebral blood flow and worsen neurological injury. Interventions should focus on maintaining adequate MAP and controlling ICP. Question 47. A client with acute renal failure receiving intermittent hemodialysis suddenly becomes restless and confused during treatment. Which complication should the ICU nurse suspect first? A. Disequilibrium syndrome. B. Hypercalcemia. C. Acute liver failure. D. Pulmonary embolisme. Answer: A. Disequilibrium syndrome. Rationale: rapid osmotic shifts during dialysis can cause cerebral edema, leading to restlessness, confusion, nausea, and neurological deterioration. Question 48. A client with severe pneumonia develops septic shock and refractory hypotension despite adequate fluid resuscitation. Which medication should the ICU nurse anticipate administering first line? A. Dopamine. B. Norepinephrine. C. Epinephrine bolus. D. Adenosine. Answer: B. Norepinephrine. Rationale: norepinephrine is the preferred first-line vasopressor for septic shock because of its potent vasoconstrictive effects and improved outcomes. Question 49. A client receiving mechanical ventilation develops ventilator-associated pneumonia, VAP. Which intervention is most effective for prevention of this complication? A. Routine ventilator circuit changes every shift. B. Maintaining the head of bed elevation at 30 to 45 degrees. C. Administering prophylactic antibiotics daily. D. Frequent saline instillation before suctioning. Answer. B. Maintaining the head of bed elevation at 30 to 45 degrees. Rationale. Elevating the head of the bed reduces aspiration risk and is a key evidence-based intervention for preventing VAP. Question 50. A client with multi-system organ failure develops sudden ventricular tachycardia without a pulse. Which action should the ICU nurse take first? A. Administer 4-amiodarone before compressions. B. Begin high-quality CPR and prepare for immediate defibrillation. C. Obtain a 12-lead ECG before intervention. D. Administer atropine 4 push. Answer. B. Begin high-quality CPR and prepare for immediate defibrillation. Rationale. Pulseless ventricular tachycardia is a shockable cardiac arrest rhythm requiring immediate CPR and rapid defibrillation according to ACLS guidelines. Congratulations on completing all 50 critical care rapid-fire questions. Whether you scored high or discovered areas that need more review, every question you answered has strengthened your clinical judgment and NCLEX readiness. If there were questions that challenged you, revisit those topics and practice them again until they become second nature. Consistent repetition is one of the most effective ways to build confidence for exam day. Share your score in the comments. Let others know which question was the most difficult and challenge a friend or classmate to beat your score. Keep practicing, stay consistent, and you'll be well prepared to succeed on the NCLEX. Good luck with your studies.